My name is Margaret Taub, and I'm a senior scientist. I've been at Hopkins for almost 16 years now. I came here first as a postdoc in 2009, working with Ingo Ruzhinsky and Rafael Irizarry to continue my thesis work on genetics and statistical genetics and genomics. And then I ended up staying on as faculty starting in 2012. I had studied math as an undergraduate and spent 4 years in between undergrad and graduate school, first working teaching high school math and then working for a consulting company where we use statistical modeling to help predict customer behavior in different consumer markets. And while I liked the quantitative reasoning and statistics aspects of my job, I really didn't feel like it was something that was getting me out of bed in the morning to go help companies make more money. So I tried to think about people whose life paths I admired, and I have an aunt who is an MD but does medical research. And so I was thinking, well, I'm not going to go back to medical school. Now, I never did pre-med classes or anything like that, but what's something where I can use my math and quantitative skills to work in a health-related area? And I really landed on statistical genetics as an area that I was interested in, and that's sort of how I ended up studying statistics, and I've been working in that area ever since. I really spend about half of my time on statistical education. So I've spent a lot of time working on developing course materials to help students who are just getting introduced to statistics for the first time in a public health context. But I also do a lot of collaborative research on complex diseases and trying to understand the biological mechanisms behind them using genetic and genomic data. So those are the two areas that I really work in. Yeah, so my research interests are using genetic and genomic measurements to try to understand more about the biology of complex traits like cardiovascular disease or asthma or chronic pain. And it's using measurements that tell us what's going on in people's cells and what their genetic background is to help understand what leads to development of these traits. I guess a lot of my research is really rooted in basic science, so it's really understanding the mechanisms behind diseases, but some of my more recent work does relate to actual potential policy interventions, so changing doctor behavior around treating patients who have undergone surgery in terms of making sure that they get the right pain management that they need after their surgical intervention. So it's been really fun to work on something that's a little bit more closely related to the clinic. I think the thing I like the best about being at Hopkins are the people here. I think I really have amazing colleagues, and we're surrounded by brilliant students who are excited to learn and advance science in the world. And it really is the kind of place that makes you feel motivated to always do your best and to contribute whatever you can to supporting the growth of these students and creating an environment where we produce meaningful work. Yeah, so I've recently become the program director for our master's program in the Department of Biostats, and that has been an amazing opportunity to work with our incredible master's students and help guide them through their brief time with us. They're here for about 2 years, so it's really a great chance to work with students from a wide variety of backgrounds to help them build their statistical foundations. I've also been involved in our undergraduate teaching program for many years, so I've taught a class up at the undergraduate campus for public health studies, or it's geared towards public health studies majors, and it's an introductory biostatistics class, and that's been a really fun opportunity to try innovative teaching methods to reach a broad audience of students who have varying backgrounds and interests in biostatistics, and to do it in a way that engages them and helps them feel supported, and while also teaching them some really useful things. I think that biostats is a great career path for people who like quantitative sciences. It's really all about reasoning with data and using firm, solid mathematical foundations to make decisions about public health related problems. So you want to have both the math and the interest in health and health science. If you have those two things, it's a great direction to go in. There's a really wide variety of problems you can work on.